Hi, welcome back to Mike's Diabetes World. Current blood sugar is at 4.9. So earlier today, I had a bad reaction and it went down to 2.9. So we treated it with glucagon, and it went up and stayed high, and then took my insulin at dinner and it dropped down. So I'm hovering now at 4.9. All pretty good. Yeah, I guess. I have most of my calibration that was done before dinner. I'm doing this a little bit later than normal. You can see that my pump was really working today. I was really doing a lot. Currently, of active insulin, I have 0.850 units. So that's all pretty good. Time and range, well, the 100 is gone, obviously. 85% time and range. Still a good number. Just one sec here. '85. Above, I was 13% above, 2% below. Average sugar is 7.5. So 13, if we do the math again, let's get our little calculator here. Never is around when you want it. There it is. 13 times 15 divided by 60 equals 3.25 hours. So roughly 3 hours and 15 minutes, I was out of range. Yeah. Today, I want to talk to you about infections. We'll be right back and we'll get going. This channel is provided for informational purposes only. Contact your physician for any diagnostic or treatment plan. Why are infections so prevalent in the life of a diabetic? Well, just think of all that sugar. Yeah, you don't need to see that. All that sugar in your system all the time. Bacteria is going to love that. It's little food for them. So any sort of open wound can be a conduit for infections. You stub your toe. When I was still walking and into a chair and out of a chair, I would sometimes stub my toe getting out of it or getting into it. And my baby toe sometimes really got infected. And I was under care of a home care nurse coming out every day and then every second day. It seemed like, oh God, 2018 was a year. But we survived. I have one saving grace, and that is I have good circulation into my feet. So I'll tell you one thing, feet and eyes are the two things that are going to be attacked more than anything else. It's funny. I've always thought this was funny. I go, eyes affected, but ears aren't. I don't know why. Guess ears aren't serviced with blood vessels as prevalent as eyes are. I when I was a young diabetic, I always thought, well, why not hearing? How can you stop from getting infections? Well, there's no surefire way for you to stop infections. First thing you're going to have to do to probably stop you from getting any sort of infection is number one. You know what I'm going to say. Control, control, control. Keeping your blood sugars within 3.9 to 10, which is normal range for diabetics. Whether you do it through, where is it now? It's right over here. Through the insulin pump or shots. You want to maintain your blood sugar in those levels. If you keep it within that levels, one of two things could happen. Either you're going to get a pathogen into your body, or bacteria or whatever into your body, and your body's going to fight it off. We all hope for that. But because we have higher sugar in our systems a lot of times, bacteria can grow, it can multiply. Your body saying, hey, we have an infection, and you get your fight or flight, and they're showing up and they're saying, hey, come here, and we're going to attack you. Now, if the second one happens, the infections can take off like crazy, and your body may need some help in fighting them. First of all, they may be through pills. Next, they could be because of, they can get into IV antibiotics to help your body fight them. You want to get rid of the infections. If you do get a cut, or is keep it clean. Keep it covered and clean. Open to air could possibly be the worst things. I can remember I didn't cover them. I wore socks most of the time, so the bacteria just kept festering, and that, of course, my blood sugars were so erratic. It wasn't that great. Now, keeping your wounds clean. You don't have to pour a whole bottle of alcohol on it. Just gentle soap and water. Just keeping it clean. Soak your feet sometimes. Keep your feet dry. Keep the wound covered. You can use some polysporin, but check with your doctor. Your endocrinologist. I'm not a doctor. I'm just suggesting things I have done. And it's important. You can get other infections. As a diabetic, I went into sepsis one day. I was working on my feet all day. I managed an optical store. And I got really sick. I was in so much pain at work. I called and they said, okay, can you go for a blood test? Well, The mall I worked at actually had a place where you could get blood tests done. Surprise, surprise. I went there. My doctor called me on my cell, and I had to go off the floor and take the cell phone call. And he said, I want you to go to emergency. I had sepsis, so I had to go in. I was given a whole bunch of pills, and I was admitted and put on IV antibiotics for a good portion. And it took me about a month to fight that. I've had bone infections. Somehow, my bone, they were fighting and figured it was infected. And I was on antibiotics. I'd be on so many antibiotics. I'm surprised they work. But they did a biopsy, they found out what antibiotics worked, and they took care of it and killed it. And I healed up, and I've been doing fine. So, number one, if you get an open sore, keep it clean, keep it dry. It already has food, it needs moisture to multiply. Don't give it the 2 ingredients it needs. Keep it dry, keep it clean. You can cover it, you can use some antibiotic. One thing that this kind of really just blows my mind, when I stubbed my toe and had a little infection, like an open wound, and they did the exact same for me when I was on my leg and ended up in the hospital. Don't. This really, but I guess I let it go too long and it got sick. But they started putting honey on the wound. And so don't go and open up a jar of honey and put it onto the wound. Make sure it's medical grade. And it helped. But I had gone way too far, and I ended up in the hospital. And I was in there for a good while. But, infections can be... People have lost their legs, have lost their eyes because of infections, or just high blood sugars. Don't let you be the one, and I'm not saying this to scare. If you try to keep your blood sugars between 3.9 and 10, majority of the time your body will act just like everyone else's, and you can fight back the bacteria. Now, an important point to mention here. People, we can assume, have infections in their chest. Now, they can be either bacteria or viral. Don't believe that everything needs antibiotics. Antibiotics do nothing for virus. They'll only work on bacterial, and your doctor will be able to determine which one's the best for you. With viral infections, you're going to have to treat the symptoms. So, be cautious, be aware. Not all bugs need drugs, is the saying that a lot of kids are learning in school now. But a lot of patients or parents of patients demand antibiotics because they think, oh, well, yes. Now, if you take an antibiotic for something that's not there, you have the risk of making your body antibiotic resistant, which could cause major issues. We want to stop for having more and more antibiotics becoming useless to us. So only use them if need be. And if you're given an antibiotic, finish off the whole cycle. Don't stop an antibiotic unless you are told to do so by your doctor. So let's review. Infections. How do you tell if you are infected? Oh, maybe I did do it. How do you let me answer that question, then we'll review it. Infections, if it's warm, if it's red, if it's weeping, those are probably the good sign. If your blood sugar's up, and your blood sugar will go up if you have an infection. It's kind of like your body is fight or flight. So, hey, we're under attack. We need to send everything. So they release sugar so the body can fight. Problem is, the sugar can also trigger bacterial growth. That's why you have higher sugars. So, let me go. Infections, your site is warm to the touch. It can be weeping. It can be sore. It can swell. Those are good indicators. It could just go red. I had a problem for a finger, my thumb, and it just kept getting sore and sore right here on the outside edge. And it had a little bit of a nail, and I just happened to peel that back, and I put some pressure on it, and the white blood cells just drained out. And you know what? My blood sugars were a little bit better after that. So, see your doctor if you have a major infection. Keep any cuts clean and dry. If you're given antibiotics, make sure you utilize them for the whole cycle. We don't want to go back to an era where we have nothing that our bodies can help fight. And with that, we're going to call it a day. Have a great day, and we'll talk again soon. Bye now. My email is mikesdiabetesworld@gmail.com. mikesdiabetesworld@gmail.com.